So this is part 2 of hematologic and neoplastic disorders. So if you're not, I would recommend you join Be the Match. This is an international registry of bone marrow donors. So they'll send you a cheek swab and you send it back. And then when somebody needs a bone marrow transplant, they look at this international registry in order to get the best match they can find. So some of the emergencies that can happen with our kids with cancer, sepsis. We kill off their immune system, and now they're super susceptible to everything. Minor illnesses can be life-threatening for them. Tumor lysis syndrome, as we break down that tumor, we can get all sorts of toxic waste products. Typhlitis or neutropenic enterocolitis, right? We've killed off the normal lining of the gut as well as the normal bacteria in there, and you can get life-threatening colitis. Superior vena cava syndrome. This is from a tumor in the chest. It interferes with venous return and and cardiac output. Spinal cord compression. Cancers that invade into the central nervous system, put pressure in there, give terrible back pain and can compress spinal cords or cause increased intracranial pressure. And then massive hepatomegaly, so enlarged spleen. So some of the types of anemia we're watching for, you can get it from a nutritional deficiency, usually iron, but also folic acid. Pernicious anemia, which is hard to treat, falls in here too. Toxic exposures like lead poisoning makes kids anemic. Aplastic anemia, this can be acquired or very rarely it's congenital. In aplastic anemia, everything is not just the red cells, but everything, there's decreased production. And then hemolytic anemias, things that break the red blood cells, such as sickle cell anemia or thalassemia. So what's the problem with anemia? Well, we said red blood cells, their main job is to carry oxygen. So you have decreased oxygen carrying capacity. That means we don't get enough oxygen out to the tissues. Kids, surprisingly, if the anemia develops slowly, they can be really low, but learn to adapt. And then some of the consequences of anemia, hemodilution. I always hate when we use the term blood thinners for anticoagulants because they don't change the viscosity of the blood. They make platelets not get sticky. Anemia changes the viscosity of the blood. It makes your blood runny. Hemodilution, and that has a number of effects. The first one is that it decreases the peripheral resistance. So you're pushing water instead of syrup through the blood vessels. So it's going to just go through much easier. Because of that, you're going to have increased venous return and turbulence because we've got thin blood. It's like water splashing into water splashes more than pouring syrup into syrup. So often you hear a murmur. Murmur is just turbulence, so you'll hear that. And because the heart's got to work so much more trying to push this liquidy blood with so little resistance, you can get heart failure. You do not get cyanosis. You get pallor. So because we're not carrying enough oxygen, you look pale. But cyanosis comes from having red blood cells that don't have oxygen on them. In anemia, they all have oxygen on them, we just don't have enough of them. And because we're not getting enough oxygen out, you're going to see growth retardation and delayed puberty. So how do we diagnose anemia? Well, with that blood count, we're looking at the number of red blood cells, the hemoglobin, and the hematocrit. And remember, those numbers change a little bit based on age, so always look at your reference ranges. The history and physical, we're probably going to see a lack of energy and a child who gets fatigued easily, right? They cannot get enough oxygen out to their tissues just at standard, basal metabolic rates. And if they do anything to increase their need, they just can't do it. So no energy, fatigued easily, and pallor. As I said, you don't have enough red blood cells, so you don't look pink. You don't look blue, though, because that's cyanosis, because every red blood cell is carrying oxygen. The cyanosis comes from red blood cells not carrying oxygen. And when you have that decreased red blood cell, you're susceptible to infection and you have delayed healing. So let's talk about those different types. Iron deficiency anemia, this is usually from not ingesting enough iron. And it's usually something we can prevent. So we do know this happens at specific ages typically. In preterm infants, it is a problem because that fetal iron store is put on in the last trimester. It's deposited in the last trimester, and so they don't get it. So they are at risk kind of immediately. Term babies, however, got that iron store from their mothers, but it gets used up by about 6 months of age. So after that, we often see a little physiologic anemia, kind of a dip that we expect somewhere after 6 months. When we start looking at toddlers, and that shouldn't say older infants because we shouldn't be giving cow's milk to anyone under a year, but our toddlers who drink a lot of cow's milk, they do that instead of eating food. Milk is actually very low in iron, so they're drinking milk instead of eating food that has iron, and that's probably our most common cause, is these toddlers that drink too much milk. And then adolescents, they have this rapid growth spurt where they really need more of everything, and they don't eat well at the same time. So if you remember, giving iron, it does not absorb well in a basic environment. So we are best if we give it with things like juice that have a lot of vitamin C, and not give it with things like milk that are basic. We also want to include iron-rich foods, right? Our leafy greens, meats, but no cow's milk for infants under 12 months, and even after that, we really don't want people using a bottle of milk to replace a meal. So these kids, the prognosis is really good, but if you remember, it takes a long time to change someone's hemoglobin with iron. So we should start to see an increase at about a month, but it probably won't be back to normal for 6 months. And so, make sure parents know this is going to take a long time to treat. And if you remember, iron will stain their teeth. So, older child, have them take it. They can use a straw, or if they take it, put it, back in the mouth, not on the teeth, and have them wash it down immediately after. So what foods are we going to encourage? Well, red meats, fish, tuna and salmon, eggs, tofu, enriched grains, beans, peas, fruits, leafy greens, and then iron-fortified breakfast cereals. And in fact, those baby cereals, we usually like to keep kids on that till they're at least 18 months just for the iron. Lead poisoning. This is another way kids get anemic. And so how do they get it? Well, in the U.S., the most common cause is from older homes where there was lead paint. Lead was taken out of the paint in the 70s, but older homes will have layers underneath there of lead paint. So any paint that's peeling, that lead paint can be exposed, or anytime some construction is done that turns that old paint into dust that can be inhaled. That's how you get that lead paint, the lead from the lead paint. Soil can be contaminated with lead. Food and water can be contaminated. Pottery, especially dishes that were not made in the U.S., the paints on them often have lead in them. And some home remedies we want to make sure kids don't get because they have lead. And Where do we find this? Well, impoverished urban areas where there are older rental homes. That's where you have the highest risk of problems with lead. So, as I said, it can be inhaled as a dust if you do construction, or it can be ingested. The diagnosis, we're going to see anemia. And then we really do, at every visit, the physician should be asking about risks to assess, are there risks for lead poisoning. The treatment is called chelation therapy. There are a couple different medications that can be used, but chelation is for anything that we don't have a natural way of getting rid of. So any of your heavy metals, the body just isn't good at getting rid of them. So it binds with the lead so that you then can eliminate it. Lead, however, will go out into the tissues. So when we look at blood levels, we're looking at what's in the blood, in the plasma. As we start the chelation therapy, it pulls it out of the blood, but what had settled into the tissue now moves into the blood. So you may not see an immediate drop in the level. So reassure parents, it is working. It's getting it out of the tissues. And the problem is lead poisoning, it will do neurologic damage, and that is permanent. So complications of lead poisoning at low levels, behavioral problems and learning difficulties. At high levels, encephalopathy, seizures, and brain damage. So aplastic anemia, this is also pancytopenia. So everything, across the board, everything is depressed. So not just red cells for the anemia, but also your white cells and your platelets. Occasionally genetic, but usually it's from some sort of a toxic exposure, or actually most often we don't know why. Idiopathic, right? We don't know why. So we're going to look at your history here and physical exams to really diagnosis. They have to do a bone marrow aspiration. Instead of the bone marrow being red, it will be kind of yellow. Then the treatment for this, immunosuppressive therapy, and possibly bone marrow transplant. So this is not really considered a cancer, but it's treated with the same kind of medications. Other things that cause problems by breaking down or by having abnormal red cells that then break down, sickle cell anemia and thalassemia. So sickle cell anemia, right, this is a hereditary problem. So if you remember, you have to have both the mother and the father have to be carriers, and so they each have a normal adult hemoglobin and a sickled. They're a carrier. They do not have it. This is the dominant one. So they have this, but it doesn't act. So they give half of their children normal. They give half of their children sickled. The same thing from the father. So of 4 babies, 1 lucky baby got normal adult hemoglobin from both. 2 of them, 2 out of 4, so 50%, are carriers. They got a normal and a sickle. And 1 out of 4 is going to have the disorder. And those cells, just like the name says, they are sickled. The problem is we should have this nice biconcave. The sickle cells, particularly when they get hypoxic, dehydrated, something happens, it makes those cells then get hard, firm, and sickle. And if you think you could pour, something round like marbles down a tube, but if you pour screws, they don't flow as well, and especially in a bend, the marbles will get through the bend. The screws will clump up in the bend, and that's exactly what happens with the sickled red blood cells. In places where you've got bends, so particularly in joints, you'll get clumps of cells which block the flow, which makes the tissue past there hypoxic. Hypoxic tissue is painful. The big thing with this is it's horribly painful.